A pandemic is an epidemic that spreads simultaneously everywhere, covering a large geographic area. A pandemic is an epidemic that spreads across almost an entire country or continent, usually affecting large numbers of people. Coronavirus disease 2019 or COVID-19 was the first discovered in Hubei province, precisely in the city of Wuhan, People's Republic of China. Starting from a video that went viral on social media, which highlighted the isolated condition of the city of Wuhan. There was speculation that people still use it was a joke. Ironically, until COVID-19 reached in Indonesia, many people still thought it was a news that was exaggerated, even though it is very clear that the virus has a very bad affection on the health of our body. COVID-19 has had a major impact on the people's life in various fields, especially in the health sector. This virus weakens the immune system and attacks the respiratory system. In Indonesia, the first confirmed positive case was found in March. At the same time, World Health Organization announced that there had been an outbreak and a pandemic in all over the world. Since then, people all over the world must adapt to the existing condition. The impact that was most felt, apart from the health sector, are the economic sector, tourism, and education. They were experienced a significant impact in the economic sector, one of which in financing sector, which brings bad things that are very detrimental to industries. Restructuring of financing to debtors causes a decrease in the income of finance companies and ends in the dismissal of workers due not to be able to pay salaries anymore. This is what makes Indonesian economic condition drastically decline. In the education sector, the coronavirus causes students to not be able to go to school and study by face-to-face properly and must be replaced with online school, which are a burden on the unprivileged students, and online learning is not really effective for students. Even in the tourism sector, these things are not going well due to restriction on mobility due to the COVID-19 pandemic. Doctors and nurses as the main word in tackling this pandemic. Then, what about the role of public health in responding the COVID-19 outbreak? As we know, public health is very different from doctors, where doctors themselves place more emphasis on treatment and recovery and tackling this outbreak. Doctors will provide treatment and medication and continue to monitor the recovery pace for COVID-19 survivors. Meanwhile, public health, which emphasizes aspects and prevention and also education, strives as much as possible in educating the people, both those who have been affected and have not been affected by COVID-19. Through health promoters who play an important role in carrying out preventive efforts and educating the public health. Public health promoter can provide education through existing social media or by making advertisement on the TV related to conditions that are relevant to current condition, or in the form of an invitation to always comply with health protocols. In addition to advertising, health promoters can still carry out by face-to-face counseling by using the video conference, which is the technology that is currently developing. health promoters can hold online-based seminars or health webinars to related to the COVID-19 pandemic, which will discuss and study more fully regarding prevention efforts to improve clean and healthy lifestyle during a pandemic, as well as evacuation efforts when people starting to feel symptoms which contracting the virus. It doesn't stop there. After almost 2 years coexistence with COVID-19, in early 2021, a COVID-19 vaccine has been founded. Through long clinical trials and trials all time, the COVID-19 vaccine has become one of the main efforts to end this pandemic. As one of the health promoter, I'll also starts with attracting sympathy and educating the entire community to carry out COVID-19 vaccination. Health promoters through an approach to the community can explain in detail that giving vaccine is very important, not only to protect community from COVID-19, but also to restore the social and economic condition of our country. Vaccination and immunization aims to make a person's immune system able to recognize and quickly fight bacteria or viruses that causes infection. The goal to be achieved by giving the COVID-19 vaccine is to reduce morbidity and mortality due to the virus. Although not 100% able to protect a person from coronavirus infection, but this vaccine can reduce the possibility and severe other symptoms and complications due to COVID-19. In addition, the COVID-19 vaccination aims to encourage the formation of herd immunity. After explaining that, finally, health promoters can influence change in people's behavior and can even play a role in creating healthier individuals, families, communities, workplaces, and organizations as a result of health promotion through counseling activities that are provided continuously to the entire community, including children, adolescents, pregnant women, to the elderly. Thus, health promoters have a major role in controlling the COVID-19 pandemic. So, I think as a public health worker later, we must to do that. We must educating, we must do a prevention for adult people, and stay safe, stay at home, and stay healthy.